Hi, my name is Lucy, and this year I have been spending my time studying under other undergraduate students just like me in order to continue to emphasize the importance of positive mental health on a college campus. This project is in collaboration with my faculty mentor, Dr. Ellen Usher, as well as the other members of the Reef Research team. College is stressful. At a young age, we are pushed towards answering the questions of who am I and who do I want to be in the future. When thinking about college, it is easy to ideally hope it will look a lot like this, always succeeding and smiling with a clear path to graduation. But it often ends up looking more like this. College brings new challenges and changes to a student's life at every turn. While all people experience stressors differently, mental health concerns have been increasing on college campuses. Whether it looks like this, or this, students may experience mental health concerns such as depression, stress, and anxiety. With these increasing mental health concerns, college counseling centers have reported an increase in the demand for mental health related services. At one university, high rates of mental health distress were found among engineering students specifically. However, national research has shown that fewer engineering students are diagnosed with a mental health concern than their peers, but also that engineering students were less likely to seek out help. If engineering students are less likely to seek out help, they may be experiencing undiagnosed mental health concerns. This also raises the question as to whether concerns like stress or anxiety have been normalized in engineering disciplines. So, why is this important? If these issues are regarded as a normal experience, engineering students may not see them as a problem and may be less likely to try and seek help. This could be even more problematic for underrepresented groups in engineering, such as female or non binary students and Black students. These historically underrepresented groups may be even more likely to suffer from mental health concerns like anxiety and depression. A greater understanding of engineering students' mental health and help seeking might provide valuable insights to these issues. This study aims to describe the levels of mental health concerns reported by engineering students and to examine their relationship with students' attitudes, intentions, and behaviors related to seeking help. Given previous research showing that men and women report different levels of mental health distress and help seeking behaviors, the study will also investigate possible gender differences in students' reports. The first research question is, what is the level of mental health concern reported by undergraduate engineering students? Do women and men report similar levels of mental health concerns? Next, how do undergraduate engineering students describe their help-seeking attitudes, intentions, and behaviors? Based on previous work, I hypothesized that women will report higher levels of mental health concerns. Finally, I will examine the relationship between mental health concerns and students' help-seeking attitudes, intentions, and behaviors. I expect that students who report higher levels of mental health distress will report more positive attitudes and beliefs towards seeking help. This study will be conducted using secondary data collected from an annual national dataset known as the Healthy Minds Study. Data were collected through a web-based survey sent to students. I will be using data collected from 2018 to 2019. I will also only be using the responses of students who reported being in the field of engineering. The dataset included responses from 6,567 undergraduate engineering students from 79 institutions across the country. 64% of participants identified as white and 65% identified as male. The mean age of participants was 22 years old. Participants completed several measures in the survey related to various mental health concerns. For this study, I focused on two major mental health concerns found on a college campus: anxiety and depression. Participants were also asked about help seeking. Help seeking is a complex measure that combined items related to attitudes towards seeking help, intentions to seek help, and help seeking behaviors. Depression was measured using the Patient Health Questionnaire 9, and anxiety was measured using the Generalized Anxiety Disorder 7-item scale. Both measures began by asking how often they had been bothered by the items listed in the previous 2 weeks. The mental health of students was also measured with reported professional diagnoses of depression and anxiety. To measure help-seeking attitudes, intentions, and behaviors, 8 questions were asked, including how helpful they believe therapy is for a depressed individual, whom would you talk to if experiencing serious emotional distress, and if they had ever received counseling or therapy for a mental health concern. I will only be showing results for one of these questions. For this research, distress was measured using anxiety and depression. The PHQ-9 and the GAD-7 questionnaires were scored, and students were separated into groups based on their symptom severity: those with minimal symptoms, mild symptoms, moderate symptoms, and severe symptoms. Students who qualified as moderately to severely anxious and/or depressed were categorized as distressed. So, what did we find? For the sake of time, I will only be presenting 6 of our findings: the descriptives for depression and anxiety severities and the gender differences between them, 1 of the 8 help-seeking questions, and finally, the comparisons between distressed and non-distressed students' attitudes towards help-seeking. Descriptive statistics were run on the severity of symptoms for depression. In a self-report, 19.8% of engineering students reported having moderate to severe depression. Along with depression, 15.9% of engineering students reported having moderate to severe anxiety. Next, we examined gender differences in the severity of depression and anxiety symptoms. Women in engineering reported having higher severities of depression than men. As well as this, non-binary students in engineering reported disproportionately more distress than their male and female peers. Similar results were found for anxiety. Once again, female and non-binary students reported higher severities of symptoms than men. Chi-square tests of independence were also run and showed a significant relationship between depression and severity and gender. Once again, for time purposes, I will only be showing you the descriptions of 1 of the 8 help-seeking variables. Here, we can look at whom students said they would talk to if experiencing serious emotional distress. Only 29% of engineering students said they would seek out help from a professional mental health worker when experiencing distress, and 10% of students said they would not talk to anyone at all. When observing how distressed and non-distressed students view the effectiveness of someone seeking professional help, distressed students appeared to be more likely to say that it would not be helpful to a clinically depressed individual, but more tests would be needed to know for sure. In conclusion, 19.8% of students in engineering are experiencing moderate to severe levels of depression, and 15.9% for anxiety. Women and non-binary students reported experiencing more severe levels of distress than men. Finally, about 10% of all engineering students would not seek out any sort of help when experiencing a mental health concern, and distressed students appear to be less likely to view professional help seeking as effective. While it is known that engineering students are less likely to be diagnosed with a mental health concern than their peers in other fields, many of the distressed students in engineering report they would not seek out help or believe that seeking help could make an effective difference in their life. This study is ongoing and will attempt to look further into the mental health and help seeking of engineering students. Future research should further investigate distress symptoms in women and non-binary students, as well as how to bridge the gap between distressed students in engineering and seeking out help. Thank you, and I invite all of your questions.